Diclofenac, also known as Aleve 1% topical gel, is a non-steroidal anti-inflammatory drug, Nsaid, used to relieve joint pain from arthritis. It belongs to a class of drugs that reduce pain and inflammation. If you have a chronic condition like arthritis, it's important to talk to your doctor about other treatments and medications to manage your pain. It's important to use this medication as directed by your healthcare provider and to avoid using more than the recommended dosage. Typically, this topical gel is applied to the affected joint 4 times a day, but always follow the specific instructions given by your doctor. Before you start using diclofenac, make sure to read the medication guide and patient instructions for use provided by your pharmacist. This medication is for use on the skin only, and you should use the dosing card provided with the medication to measure the right dose. Gently rub the medication into the entire affected joint as directed by your doctor, usually 4 times daily. If the package instructions direct you to reuse the dosing card, make sure to rinse and dry it after each use. Do not apply the medication on skin that has cuts, infections, or rashes. After applying the medication, do not shower, bathe, or wash the treated areas for at least an hour. Also, wait at least 10 minutes before covering the treated area with gloves or clothing. Do not wrap, bandage, or apply heat to the treated area. The dosage is based on your medical condition and response to treatment. Make sure not to apply more than the recommended amount of diclofenac per day to any single joint. Always discuss the risks and benefits of using this drug with your doctor or pharmacist and use the medication at the lowest effective dose for the shortest possible time. Remember, for certain conditions, it may take up to 2 weeks of using this drug regularly until you get the full benefit. If you are using this drug as needed, make sure to use it as the first signs of pain occur for the best results. And always tell your doctor if your pain lasts or gets worse. When using Aleve, diclofenac, 1% topical gel, you may experience skin irritation or redness at the application site. If this persists or worsens, be sure to notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. This medication has the potential to raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Seek immediate medical attention if you experience any serious side effects, such as signs of kidney problems or symptoms of heart failure. While rare, this medication can cause serious liver disease. If you notice any symptoms of liver damage, such as nausea, loss of appetite, or yellowing of the eyes or skin, seek medical help right away. In the rare event of a serious allergic reaction, seek immediate medical help if you experience symptoms such as fever, rash, swelling, or difficulty breathing. Remember that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA, and if you are in Canada, you can report them to Health Canada. Non-steroidal anti-inflammatory drugs, like diclofenac, may increase the risk for a heart attack or stroke, especially if used for a long time. This risk is higher for older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. Do not use diclofenac right before or after heart bypass surgery. This drug may also rarely cause serious bleeding from the stomach or intestines, especially in older adults. If you experience severe abdominal pain, black or bloody stools, or vomit that looks like coffee grounds, seek medical help immediately. It's important to talk to your doctor or pharmacist about the benefits and risks of using this medication, and to follow their recommendations for the best time to take it and the appropriate dosage for your specific condition. Before using Aleve, diclofenac, 1% topical gel, it's important to talk to your doctor or pharmacist if you have any allergies, especially to aspirin or other NSAIDs. This product may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. It's also essential to inform your doctor or pharmacist about your medical history, including any history of asthma, liver disease, heart disease, high blood pressure, or kidney problems. Kidney problems can sometimes occur with the use of Nsaid medications, especially if you are dehydrated or have certain medical conditions. It's important to stay hydrated while using this medication and to promptly report any changes in the amount of urine to your doctor. Additionally, be sure to inform your doctor or dentist about all the products you use before having surgery. Using this medication may increase the risk of stomach bleeding, especially when combined with daily alcohol and tobacco use. It's important to limit alcohol consumption and stop smoking while using this medication. This medication may make the treated area more sensitive to the sun, so it's essential to limit sun exposure and wear protective clothing when outdoors. It's also important to discuss with your doctor whether you should use sunscreen along with this medication and to report any sunburn or skin changes. Older adults may be at greater risk for certain side effects while using this drug, so it's important to discuss this with your doctor before use. Women of childbearing age should also talk to their doctor about the benefits and risks of using this medication, especially if pregnant or planning to become pregnant. If your doctor decides that you need to use this medication during pregnancy, it should be used at the lowest effective dose for the shortest possible time. Consult your doctor before breastfeeding while using this form of diclofenac. It's important to be aware of potential drug interactions when using Aleve, diclofenac, 1% topical gel. This medication may interact with other drugs, such as aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, lithium, methotrexate, and others. It may also increase the risk of bleeding when used with antiplatelet drugs, blood thinners, and certain other medications. When using this medication, it's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to diclofenac and may increase the risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking the aspirin unless instructed otherwise. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to consult your doctor before starting, stopping, or changing the dosage of any medicines. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose or swallowing may include severe stomach pain, changes in urine output, and slow or shallow breathing. When using Aleve, diclofenac, 1% topical gel, it is important to not share this medication with others. Your doctor may also recommend lab and/or medical tests, such as blood pressure, complete blood count, and liver/kidney function tests while using this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. In addition to using the medication, lifestyle changes such as weight loss if needed, and strengthening/conditioning exercises may help improve flexibility and joint function. It is important to consult your doctor for specific instructions on implementing these lifestyle changes. Remember that the best time to use this medication and the appropriate dosage will be determined by your healthcare provider. If you are using this medication regularly and you miss a dose, take it as soon as you remember. If it is almost time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not apply extra medication to make up for the missed dose. Make sure to store Aleve, diclofenac, 1% topical gel at room temperature and do not freeze it. Always keep medications out of reach of children and pets. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to dispose of it correctly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.